Doctors in the past sometimes treated epilepsy with rituals that sound unbelievable today, yet they were built on fear, superstition, and a sincere desire to stop the fits. In many medieval towns, a seizure wasn't seen as a medical event at all. It was treated like a struggle. The body was overtaken, the mind spoken over, and the right cure meant persuading invisible forces to let go. First, families would bring the patient to a holy place or a respected healer, because faith was considered the strongest medicine available. Next came the strange part: words and objects used like tools. Clergy or local physicians might read prayers meant to bind the evil presence, sometimes while others held the patient's hands or kept watch over their breathing, not out of modern science, but to stop panic and protect the person from harm. Then the remedy turned physical. Some practitioners used talismans, small pieces of inscribed metal, cord, or amulets, believed to lock the danger inside the body's boundary. Others prescribed smoke or bitter herbs in controlled ways, hoping to drive away whatever was thought to be entering through the mouth or nose during the fit. Surprisingly, there were also community rituals meant to shame or redirect the curse. In certain regions, neighbors might gather, point out the supposed cause, or perform repeating chants at specific times, because repetition was believed to weaken the hold. One lesser-known belief claimed that epilepsy could be transferred. The patient was passed through a boundary or exchanged with an object, so the trouble would follow the rule of exchange rather than stay in the person. And through it all, the logic never felt cruel to those who practiced it. They watched the suffering closely, treated seizures as a sign of spiritual imbalance, and tried to restore safety with every ceremony they knew: prayers, coverings, binding charms, and careful, step-by-step handling during the most terrifying moments. Keep watching, because the next remedy involves something doctors once collected not to study the body, but to trap the cause. Using rules so odd they reveal exactly what people thought epilepsy was, and why they believed their method could work. Why epilepsy was seen as a mysterious condition. Epilepsy was long treated as something strange and almost supernatural, partly because its signs looked like a doorway between ordinary life and an unseen force. People saw sudden falls, stiffening, odd cries, and afterward confusion, and they often believed the body was being taken over rather than simply misfiring. In many communities, the condition was wrapped in fear, shame, and rumor, not because anyone wanted cruelty, but because the patterns felt impossible to predict. A seizure could happen during cooking, walking, or speaking, and the abruptness made observers reach for stories about spirits, curses, or divine punishment. Even caregivers sometimes responded with urgent reverence, as if the person might be lost to something that demanded ritual rather than medicine. Religious explanations were especially powerful. In some places, epileptic episodes were interpreted as demonic possession or a special trial sent to test the faith of the family. Elsewhere, people framed it as a mysterious gift or omen, which could be comforting to believers yet still isolating for the patient, because everyone watched their body as if it were a public message rather than a private illness. Doctors and healers also relied on older medical ideas that treated the body as a system governed by imbalance and hidden forces, even when they didn't mean anything mystical by it. When seizures appeared without warning, it was easier for them to assume that evil agents or corrupted humors had found a route into the mind and nervous spirits, rather than accepting that the cause could be inside the brain in a way they could not see. That blend, supernatural meaning plus bodily theories, helped explain why epilepsy attracted both prayers and strange clinical gestures. A striking detail is how strongly the environment around the patient mattered to historical minds. Some communities believed that certain places, sounds, or even the presence of specific people could worsen attacks, so households tried to control who entered the room and how the patient was handled. The logic was simple and vivid. If the episode was linked to unseen influences, then careful guarding of the household's spirit space felt like protection. Folk interpretations could be surprisingly specific, too. Certain cultures treated the condition as contagious in the sense of spiritual contagion, avoiding close contact or using protective charms when assisting the afflicted, not always from cruelty, but from the belief that danger could pass through proximity. That's why a patient might be helped with dramatic care during a crisis, yet later be kept at a distance in daily life, watched like a living warning. Even when formal healers used practical remedies, the mystery stayed central because epilepsy resisted consistent observation. There was no reliable way to classify seizures or measure triggers in a way that could reassure families, so each attack felt like fresh proof that the cause was hidden and powerful. Respect for the patient could coexist with fear, and caregivers sometimes spoke gently while still treating the event as an encounter with something beyond human control. Across places and traditions, the same emotional pattern repeated. Seizure episodes looked too sudden, too intense, and too otherworldly to fit ordinary illness stories. That is how epilepsy became a condition people described in whispers and rituals, with explanations that aimed to answer one urgent question: what force could move through a person so completely, and how could anyone keep it from returning? The strange remedy doctors used to control seizures. Epilepsy was often treated less like a medical problem and more like a dangerous spiritual or bodily imbalance. So doctors leaned on rituals meant to chase out whatever they believed was attacking the person. Many clinicians described seizures with plain, frightening language, as if the body were being invaded. Treatments aimed to restore harmony through sympathetic magic, religious protection, and careful handling of the afflicted body, because people assumed the cause could be persuaded, bribed, or warded off. One unsettling method centered on using the first signs of a seizure as a kind of diagnostic omen, then responding immediately with protective actions. Patients were sometimes made to sit or be held upright to prevent further spreading of the disturbance, and attendants might prepare charms before the episode ended. Relatives would draw signs over the person's head or press blessed objects against the skin, because blessing was believed to change the invisible forces surrounding the body. In some places, there were strict rules about what should or should not be said during an attack, reflecting the belief that certain words could feed the affliction rather than calm it. Doctors in multiple eras also relied on physical remedies that were chosen for symbolism as much as for effect. A common pattern was to treat seizure-like convulsions with substances thought to cool the body or counteract harmful humors, using mixtures of herbs and minerals prepared with great care. Some practitioners used fragrant or bitter preparations to purge the body, because they believed bad influences clung to the patient's breath and secretions. There were also treatments involving specific materials, where an item's color, smell, or origin mattered just as much as its ingredients, since the body was considered responsive to correspondences in nature. A more startling approach appeared in beliefs about the devouring nature of epilepsy. Certain traditions suggested that the affliction could be transferred away if handled properly, so caretakers used step-by-step transfer rituals that began by observing the seizure closely. The practitioner might have the patient keep still, then use a cloth, charm, or container to collect what was blamed for the convulsions, treating it as if it contained the harmful power. The collected item was then disposed of in a controlled way, burned, buried, or sealed, so the problem could not return to the body that suffered it. Even when the logic was strange, the caretakers often acted with real compassion, speaking softly and trying to keep the patient safe from injury while performing the ritual quickly. Religious practice also shaped everyday treatment in ways that could feel ceremonial and intimate. Some physicians prescribed prayers, psalm-like recitations, or visits to shrines, because the seizure was treated as something that could be interrupted by divine authority. People sometimes kept small protective items close, bits of consecrated cloth or worn tokens, because the boundary between help and harm was imagined as a matter of proximity. During recurring attacks, there were routines of fasting, special baths, and scheduled offerings, guided by the idea that the patient's spiritual state and bodily stability were tightly connected. Another lesser-known detail was how strongly community behavior mattered to these remedies. Families were often told to act as quietly as possible, avoid startling the patient, and maintain respectful gestures, since disrespect was believed to provoke the affliction. In some regions, neighbors were recruited to witness the ritual outcome, because public acknowledgement made the protective action feel more credible and powerful to believers. Even the timing of actions could be emphasized, with caretakers choosing moments that felt right according to local custom. because seizure control depended on more than one person's will. The strange medical logic of the time remained consistent even when the tools changed. Epilepsy was approached as a force that must be managed through protective symbolism, disciplined care, and carefully staged steps. Doctors and families frequently combined warding objects, prayer, and bodily management, holding the patient steady, preventing harm, and carrying out the next part of the ritual without delay. Seen through that lens, the remedies were not random superstition. They were structured attempts to regain control when the cause seemed invisible and frightening. Today, the explanations differ, but the historical record shows how seriously people tried to help, using the only maps they believed could lead them out of terror. Did any of these treatments actually help? Long before physicians had tools to observe the brain, epilepsy was often treated as something the body caught from outside forces or as a disturbance of the spirit. In many places, it was even called a curse, a visitation, or a sign of divine attention, and that belief shaped every cure. Doctors and healers watched the fits closely, then built treatments around what they thought the condition meant, not around how the nervous system works. Some remedies were simple and surprisingly consistent. People tried to steadily drain fear and agitation from the household, because dread was believed to invite further seizures. Families would recite prayers over the patient, sometimes at doors and thresholds, because thresholds were thought to be crossings where harmful influences could slip in or out. Others performed ritual cleansing with water tied to religious meaning, water poured in a careful pattern, then offered to the patient to wash hands, face, or forehead as a symbolic resetting. When symptoms had a social edge, healers also warned relatives to avoid shouting or arguing near the sick person, since loud conflict was thought to feed the affliction. A number of practitioners turned to materials and substances meant to counteract tainted influence. In some regions, amulets were worn for protection, pieces of cord, engraved tokens, or objects carried against the body, often blessed with prayer so the protective force would stick. During certain ceremonies, a healer might smear a prepared mixture on the patient's brow or hands, believing it would bind the invisible cause. Even the timing mattered. Some treatments were done at dawn or during quiet hours because calm was thought to weaken the power of the afflicting force. But the most striking question is whether any of these strange methods actually helped. Evidence from the time doesn't give clean proof, because many seizures naturally come and go, and many remedies were used alongside prayers, rest, and close attention from family, all of which can make outcomes look better even when the treatment isn't directly curing anything. Still, some approaches could plausibly reduce triggers as people understood them. A ritual that demanded a dark, quiet room, steady routines, and reduced stress might lower the chance of provoking another episode, especially since many patients experienced fits during emotional strain or fatigue. When families treated the patient gently and controlled the environment, they often created conditions in which fewer harmful, outside influences were believed to enter. There were also treatments built around transfer magic, where the illness was meant to be relocated away from the body. One common pattern was to bind the fit to an object or to pass a ritual act from the sick person to another thing, such as a bundle, a cloth, or a symbolic substitute, then dispose of it in a way that kept the danger from returning. Another version involved careful handling of the seizure moments, protecting the patient, limiting panic, and then performing a follow-up ritual immediately after, because the belief was that the affliction was most vulnerable at the boundary between attack and recovery. Different cultures sometimes offered surprising specificity that looks odd from the outside, but made emotional sense inside the system. In some communities, people blamed epilepsy on a particular kind of spiritual interference and therefore used counter-rituals aimed at that exact culprit, such as calling on specific holy figures or repeating set prayers with tightly guided movements. Healers might insist that the patient be treated with respect and privacy, because humiliation could provoke the affliction. Others believe the illness could be strengthened by observing it too closely, leading to a steady, controlled atmosphere around the patient instead of a spectacle. So did these methods help? The fair answer is that some patients likely improved in the short term when treatments reduced fear, enforced rest, and offered consistent care, but many remedies were not designed to address the true cause of epilepsy, as it is understood today. Even when rituals didn't cure the underlying condition, they could still change daily life, calming the household, reducing harmful behavior, and giving patients a sense of safety. That combination of gentleness, routine, and reduced stress could make seizures appear less frequent for some people, which healers would naturally interpret as proof that their logic worked. At the same time, it is important to notice how often the medical logic of the era led to risky practices. Some caregivers sought evidence of curses, demanded proof through repeated rituals, or blamed patients when fits returned, tightening fear rather than easing it. Still, within the strange methods, prayers spoken with care, blessed objects kept close, cleansing water used thoughtfully, and ceremonies built around calm. There were also elements that could genuinely improve comfort and reduce the turmoil that surrounded each attack. The treatment's biggest benefit, when they did help, often came not from a direct correction of the condition, but from the way they reshaped the patient's world during and after each episode. In candlelit houses and stone wards, doctors once believed epilepsy was not a disease, but a visitor, an invisible force that could be argued with, frightened away, or driven out. When the final days of their strange treatment arrived, the goal was simple in their minds: stop the fit by changing the world around the patient, one ritual at a time. First, they tried to protect the body from bad influence. Family members held the patient while a healer traced symbols in salt or ash along doorways and windows, as if sealing the boundary between safe air and harmful spirits. Then they moved to the head itself. Wet cloths were warmed and pressed to the forehead, not as comfort alone, but as a message to calm whatever they thought was knocking inside the skull. Next came the tests of belief. Some healers demanded proof, listening for patterns, watching the timing, and asking which days seemed worse. In certain places, people wrapped offerings in cloth and placed them near the bed while praying for mercy in a careful, orderly rhythm, because the logic was that devotion could outstubborn the curse. And if a patient was willing, a priest or folk healer might lead a procession through the village at dawn, making sure that unwanted presence had no quiet corner left to hide. Then the more surprising remedies appeared, meant to be both practical and symbolic. A few traditions used specially selected materials, herbs burned for smoke to clean the air, or powders kept in small pouches to be rubbed into the hands or tied near the wrist. Some doctors tried to shift luck by changing routines, new bedding, a new bowl, a different seat, because they believed the body remembered paths and the curse clung to familiarity. In other regions, people turned to marks and tokens, carved charms, stamped coins, or small stitched pieces worn under clothing, each one treated like a barrier that would intercept the fit before it arrived. Some practitioners even followed step-by-step transfer ideas. After prayers, a healer might touch an object used during the ritual, such as a cup of water or a bundle of herbs, then pass it to another person to carry away the danger. The patient was watched closely afterward, not to measure nerves or brain activity, but to notice whether the visitor had slipped off the track they had prepared. The ending, in stories like these, often looked strangely hopeful. If an episode eased, the family thanked the method and repeated it in the same careful order. If it didn't, they adjusted the signs, different prayers, a new charm, a different incense blend, because the logic was never random to them. It was a conversation with fear, guided by tradition, performed with the belief that the patient deserved protection and patience, even when the reasons were baffling. And here's the connection to today. Even though we now understand seizures differently, the human urge is the same. People want a way to hold the chaos still, to restore safety, to keep a loved one from being swallowed by uncertainty. That's why these old practices feel both strange and deeply familiar. If you felt your attention sharpen at the rituals, keep going. There are more forgotten medical ideas like this, where medicine mixed with myth, prayer, and everyday life in ways that still surprise us. Follow along for the next chapter of this journey, and watch closely. History rarely gives simple answers, but it always reveals how people tried, step by step, to care.